thank you for joining me for this Q&A session. And I'm actually going to give a brief presentation as well. And it was kind of last minute. Wasn't expecting to give any type of presentation. But before doing that, let me just do a few things. First of all, I'll just share some resources for those who are new to natural endocrine solutions in the Save My Thyroid world. So I got hundreds of articles on my website, naturalendocrinesolutions.com. If you haven't done so, definitely check it out. And then also my podcast. So savemythyroid.com and just click on podcast, and that'll take you to my podcast. So definitely take a look at that. I have a few books out. One that focuses on hyperthyroidism, natural treatment solutions for hyperthyroidism and Graves' disease. And then I have a book, Hashimoto's Triggers, and both could be found on Amazon. And then every now and then I'll have someone ask how they could work with me. So you could visit askdreric.com for some information on that. And that is it. So if there are questions, you could start asking them, but I'm going to give a brief presentation, as I mentioned. All right, so you should be seeing this website. So this is from Dr. Amy Burkhart, and really good article about gluten. We all here, or probably most watching this, are familiar with avoiding gluten, have heard to avoid gluten, and I'm sure many already are doing so. And so this is a very interesting article, 6 reasons to test for celiac disease before starting a gluten-free diet. Now, obviously, if you already have started a gluten-free diet, then this doesn't apply to you, but I'm sure there'll be some questions for those who are currently gluten-free. I know a lot of people, before they work with me, they're already gluten-free. That whether it's that some of them are on a strict autoimmune paleo diet, some of them have just avoided gluten, some gluten and dairy, but it's very common for people to already be gluten-free before seeing me. And the reason I brought up that I decided to give this presentation is just because I was chatting with someone else, another practitioner, and she alerted me to this article. And I also saw someone at a presentation not too long ago. I forgot her name, but she was another practitioner that was talking about testing for celiac disease before starting a gluten-free diet. And what my patients, when I recommend blood testing, I do recommend celiac testing, but it's more of an optional test. And I do have, like, in parentheses that if you're not on a gluten-free diet, like if you are on a gluten-free diet, you really can't test for celiac disease. So, and again, I'll talk more about that. I'm not going to spend too much time on this, but just figured I'd spend maybe like 10 minutes and then jump into the Q&A. So yeah, but after reading this, it's something I think all practitioners probably should do. Really, especially with autoimmunity. So I can't say with every single one of their patients, but with Graves, Hashimoto's, because if you have one autoimmune condition, you're more likely to develop other autoimmune conditions. And this includes celiac disease, definitely in the literature. And I do see in my practice people with celiac disease who also have Graves and or Hashimoto's. Some people have all three. Some people have the antibodies for Graves and Hashimoto's, and they have celiac disease. But so one reason is because you might have celiac disease. So that's reason number one out of 6 reasons. And so celiac disease and gluten sensitivity have the same symptoms. And I'm not going to read this word for word. You could visit the celiacmd.com. And the name of the article, again, 6 reasons to test for celiac disease before starting a gluten-free diet. But one reason you might want to test for celiac disease before you go gluten-free is because you might have celiac disease, and you would want to know if you have celiac disease. And but it's also that you might have a gluten sensitivity, like non-celiac gluten sensitivity, and it talks about here as well. But it also mentions there's no real good test for non-celiac gluten sensitivity. Now there is Cyrix Labs. Cyrix Labs has their array number 3. It is a pricey test, but it's quite comprehensive, and so it's not in the research. So that's why they say there's really no, I guess, official test when it comes to testing for non-celiac gluten sensitivity. There's also a test, the Wheatzoomer, as well. And as it says here, a celiac test don't diagnose gluten sensitivity. And then some gastroenterologists will do an intestinal biopsy, which also is not going to confirm or rule out whether someone has a non-celiac gluten sensitivity. So yeah, so that's one reason. Reason number 2, you have gluten sensitivity and may need different treatment than a gluten-free diet. So, and like it says here, there's currently no scientifically proven lab test to diagnose gluten sensitivity. It can only be diagnosed through an elimination diet. And again, you first must test for celiac disease. If the results are negative, gluten is eliminated from the diet, and then including source of cross contamination. And it's saying here that it might be different because you might have to, it might not just be about gluten, it might be about FODMAPs, which I do talk about on my website. I won't get into detail about FODMAPs here, but I have, if you visit naturalendocrinesolutions.com and type in, do a search for FODMAP, you'll see at least one article on that. And reason number 3, you love your family. If you have celiac disease, they might too, which is true as well. Celiac disease is a need for family members because it runs in families. Again, not to say everybody should test for celiac disease in general, but if you have celiac disease, you very well might want to test your if you have children, to test them for celiac disease, especially if they're eating gluten. If they're not eating gluten, if they're strictly gluten-free, then once again, the test will not come out to be accurate. And it says even if they don't have symptoms, because you could have silent celiac disease. And in children, also children with celiac disease may have poor growth, behavior problems, headaches, dozens of other symptoms, and may not have the classic celiac profile that leads most doctors to consider a celiac disease. Yeah, and as it says here, if you start yourself on a gluten-free diet without testing, then celiac testing is not accurate. And then testing can pick up silent celiac disease, which means someone has celiac disease but has no symptoms. Okay, and then 4th reason will help you decide how careful to be. So if you do have celiac disease, cross-contamination could be a big problem. And that's what it says here. It only takes 1 speck of gluten to make a celiac patient sick. Again, sometimes, not everybody. And again, there's silent celiac. But and silent celiac, just because someone has silent celiac disease doesn't mean that damage is not taking place, that it's not affecting the permeability of the gut. And on the other hand, if someone has non-celiac gluten sensitivity, then they might be fine with cross-contamination, meaning if they go out to eat, it's not a big deal if they cook things on the grill, if they don't have like a dedicated grill or oven or fryer or whatever, whatever you're eating. Like, for example, not that I'm recommending French fries, but some places have a dedicated fryer to make whatever fried foods. And, but yeah, so anyway, so that's also something to keep in mind. And know you risk by getting a celiac disease test, which I'll talk about towards the end. And then you want to save money by getting a legitimate celiac disease test. And this just goes into insurance. So again, I'm not going to get into that. And and this says don't buy gluten-free food if you don't need it. So I mean, I will say that even if someone doesn't have celiac disease or even non-gluten sensitivity, I mean, you should be eating mostly whole foods, which are gluten-free. And I don't know, I don't think I don't have celiac. I don't think I have a non-celiac gluten sensitivity, but I pretty much, like, if there's anything we bring into the home that's not a whole food. You know, I have 2 teenage daughters, so like if we do bring in cookies or make cookies, typically they're gluten-free cookies. So, and then reason number 6, a formal diagnosis qualifies for disability accommodation. So again, I won't get into that. And as it says here, and as I mentioned, you must be eating gluten for celiac disease testing to be accurate. And then there's genetic testing too, but as it's not diagnostic of celiac disease. Just because you have the genes doesn't mean you have celiac disease. And I thought it mentioned the testing. So the testing, you know, there's gliadin, like the celiac panels will have gliadin, which is not specific, like that's not going to confirm celiac disease. There's another marker, transglutaminase, and transglutaminase, if that is positive, that is diagnostic of celiac disease. And I'm trying to see if they have it here. And oh, here we go. Valid screening test for adults at a blood test. So TTGIA, which is tissue transglutaminase, and total serum IgA. And the reason you want the IgA done is this is IgA's immunoglobulin A, and so you're testing tissue transglutaminase, IgA. So if you have depressed IgA levels, which I do see, this could lead to a false negative. You could also test tissue transglutaminase, IgG. And then there's also, she doesn't mention the endomysial antibodies, which is something else that a lot of panels will include. But that's it. If there's any questions with this, definitely ask. If there's, I'm answering questions that are not just related to this as well. So again, that's it. 6 reasons to test for celiac disease before starting a gluten-free diet by Dr. Amy Burkhart. And let me stop the share. And all right, so again, if there are questions, let me know. We have, and Garnett Harvey. Hello, how are you doing? I have hypothyroidism. What else can I take besides levothyroxine? So a lot of times I compare this to hyperthyroidism, just because if someone has hyperthyroidism, typically they will be told to take anti-thyroid medication such as methimazole. But when I dealt with hyperthyroidism, I had Graves, and I took bugleweed, which is an herb with anti-thyroid properties. Now, with hypothyroidism, when you have low thyroid hormone, there really is not an herbal replacement. And that's what some people mean when they want to say, and you might not mean that, and we'll talk about other options too. But I just want to say from the start that even though there are herbs that can help stimulate the production of thyroid hormone, most cases of hypothyroidism are due to Hashimoto. So that's really not a long-term solution. Like ashwagandha can stimulate the hypothalamic pituitary thyroid axis. But if someone has Hashimoto's, taking ashwagandha really is not, like, not everybody with Hashimoto's needs to take thyroid hormone replacement, I should say that. But if someone does need to take thyroid hormone replacements, there's really no alternative substitute other than like natural glandulars. So there's, levothyroxine is synthetic T4. Other options include desiccated thyroid hormones such as Armour, Nature-Throid, WP Thyroid, and NP Thyroid. I already forgot which ones I mentioned, but those are some of the more common ones. There's Armour, WP Thyroid, Nature-Throid, and NP Thyroid, I believe. And then there's glandulars like Thyrogolds is a company that has a glandular. There's a number of different companies that have glandulars. And so those are some options other than levothyroxine. All right. And we have a Facebook user. So if you're in the Facebook groups, so this is broadcasting to a couple of my Facebook groups. I have 2 main Facebook groups, one that focuses on hyperthyroidism, and then one for Graves and Hashimoto's. And then it's also broadcasting to my main Facebook page. So if you're in any of my groups, your name doesn't show, like it'll show in the group. If someone's in the group, they'll be able to see you, but for privacy purposes, it won't show up on StreamYard unless if you give StreamYard permission. And there's where when I set this up through StreamYard, there's a little, where it has the announcements that I'm doing this Q&A call. There's a link or something that you click on, and you can give StreamYard permission. If you want to show your name. I guess the only advantage of people showing their name is I could address you by name, and then number two is if someone has a question, and then later on they have a follow-up question, sometimes I'll know just by the question itself, but sometimes I won't know. And, but if it's the same person, then then better chance of me, I could just go back and see like the original question if I need to. So, but anyway, thanks for joining us from one of the Facebook groups. And stay in your lane. Happy April, everyone. Happy April to you as well. And hello, Dr. E. Hope you and yours are well. Yep. Yeah, well, I'm doing well. Family's doing well. Thank you for asking. Hope you and your family's doing well. And then, so I read about cordyceps for lowering antibodies. What are your thoughts? And do you have any other supplement recommendations? Yeah, again, when it comes to antibodies, it's there, like selenium, for example. Selenium in the research has shown to help with thyroid antibodies, with lowering thyroid antibodies. And, cordyceps, I don't know if there's really research on that. Maybe there is. I mean, cordyceps, it definitely has some benefits. It acts as an adaptogen as well. So good if someone is stressed out. But as far as lowering antibodies, I'm not sure. But the truth is, you don't want to just randomly take supplements, even if you read, like, let's say if there was an article like, 5 supplements to lower thyroid antibodies. And, then they might have research behind them, but you got to think about, why does someone have elevated thyroid antibodies to begin with? And it's probably not because they are deficient in cordyceps. Now, they could be deficient in selenium or another nutrient, which could be a factor. But the reason why someone develops thyroid antibodies is related to what's called the triad of autoimmunity, which I've discussed in the past. And I'll briefly mention it again here. So with the triad of autoimmunity, there's 3 factors that can cause autoimmunity to develop. So 1, a genetic predisposition, which of course we can't do anything about. 2 is 1 or more environmental triggers. And I talk about this in both of my books, great detail in my Hashimoto's Triggers book, which obviously that's why it's called Hashimoto's Triggers. And then number 3 is an increase in intestinal permeability, which is the medical term for a leaky gut. So really, you need to play detective work and try to find those triggers, remove those triggers, heal the gut. That's, of course, why I recommend working with a natural healthcare practitioner, just because it is, even with the natural healthcare practitioner, it could be challenging to find remove triggers, but definitely more challenging to do it on your own. But anyway, that's what I would look into. I do have some articles on my website about lowering antibodies, and you could check those out. But really, when you visit those articles, it's what I said here. It maybe goes into a little bit more detail, but it's not just take these supplements. There's definitely more to it. Okay, stay in your lane. Shared my website. Thanks for sharing it. naturalendocrinesolutions.com. Okay, so Lisa, not sure why I got blocked from your page for asking about Tepezza for Graves' disease. Yeah, I'm not sure. That is kind of odd. I know Facebook does a lot of the blocking, unless, I mean, so I know I wouldn't block someone for asking a question about Tepezza. It is monitored by my health coaches and my main staff person, but I don't see why they would block someone for asking about Tepezza. So I'm wondering if it's Facebook. I know people bring up the COVID situation on, just ask questions about, COVID, and again, they might get, and Facebook might block them. And yeah, anyway, so but usually they won't. I don't think they block. I don't know. I'm not sure if Facebook actually blocks people. They might remove the post. So if you are actually blocked, I am not sure. Unless if it was the only thing other thing I could think of is an accident. Like I remember once, when I was approving someone, I accidentally blocked someone that I didn't mean to block. Like, like when approving someone, you just click approve, and then when you don't want when you don't think someone's a good fit, or if they're going to be like, you think maybe they're like a spammer, like a robot, or something like that, just because you could tell if sometimes just by the answers that they're giving. Like if I anyway, I won't get into detail, but when you decline someone, at least I don't think there's a way to add them back in, like to undo it. Because I remember that one time I denied someone who I didn't mean to deny, and I couldn't figure out how to undo what I did. So I guess that could have been possible too. But yeah, if you got blocked, I would just and again, if you asked a question, I don't know. I guess you are in the group and you just asked, so you aren't blocked from coming in a group, just a question. And yeah, so I'm guessing maybe it was just Facebook that deleted the post, because yeah, there's, again, like I said, I wouldn't delete it. I'm pretty sure Kate wouldn't delete it, which is my main staff person. But yeah, feel free while you're here, Lisa, to ask a question. I'll stay here answering questions, if depending if there are enough questions, which many times there are, until 3 o'clock my time. I actually have a podcast interview at 4, and which sometimes, as you know, I do with these Facebook Lives, I'll do interviews that I eventually use those for my podcast. But it's up to the person. I give them the choice. Like, do they want to be on Facebook, or do they not want to be on Facebook? If they want to be on Facebook, that's what this 2 o'clock session is for. And so the person I'm interviewing after this, so she didn't choose to be on Facebook for the Facebook Live. And then next week, as of now, I have an interview actually next week in the morning, and they apparently don't want to be on Facebook either. But then the 2 weeks from today, I have someone who's at least scheduled, unless if they cancel or reschedule. But so a couple of weeks from now, I'll have a Facebook Live that will have a guest interview. So, but okay, let's go to this next person who's in one of the Facebook groups. So I read your article on thyroiditis. Such great information. I'm hyperthyroid and have subacute thyroiditis on prednisone. Prednisone now. Worried if I could fully recover if I don't know the virus, which may have caused the thyroiditis. I had no viral symptoms. I am following gluten-free and anti-inflammatory diet. Yeah, so I mean, most people who have thyroiditis don't know which virus causes it, but the key is, you need to think of viruses as more of an immune system problem. Not to say you can't, not to say there aren't times when you need to treat the virus. Obviously, these last few years, we've dealt with we've dealt with the virus, and it's not only about having a healthy immune system. That's a big part of it, but yeah. So same thing with subacute thyroiditis. Usually it self-resolves on its own, but there is a chance it could come back. And the virus, certain viruses like cytomegalovirus commonly causes subacute thyroiditis, but we can't get rid of it from our body. So that's why we need to do things to optimize our immune system health, have healthy adrenals. Most of the immune cells are located in the gut. So having a healthy gut, doing things to reduce your toxic load. And you might be already doing these things. I know you're gluten-free, following anti-inflammatory diet, and that's important. Managing stress and getting enough sleep are also important. So those are things I would focus on. And even though you don't have Graves' disease, you still want to do things that I talk about related to Graves to try to optimize your immune system health. So that's what I would say to do. And thanks for reading my article. All right, so Tammy, I have been recently diagnosed with Hashimoto's encephalopathy, TPO, So TPO, thyroid peroxidase 293, anti-nuclear antibodies 320. Any advice on this? I was diagnosed with Hashimoto's thyroiditis about 3 years ago. All thyroid labs have been normal. How can I control this? So I did write an article on Hashimoto's encephalopathy. So again, you can find that on my website, naturalendocrinesolutions.com. Don't have a lot of experience just because it's not a common condition. So I mean, you still want to focus on the immune system. So that's it's still, you still have Hashimoto's. I mean, it's also, anyway. So I would say a couple of things. One, check out the article on my website, naturalendocrinesolutions.com. And obviously there's no charge for that or any other articles. But then I would encourage you to read my book on Hashimoto's triggers. And, you could get the Kindle version for like $6, $5.99. And I'm not saying you have to read the whole book, but it's over 500 pages. So I provide a lot of content, a lot of information. And even though your thyroid labs have been normal, it's still autoimmune. You still want to do things to improve your immune system health, because with Hashimoto's, you get in that damage to the immune system. And over time, it probably will eventually show up on the lab. It might take years for it to happen. And who knows, maybe it won't happen, but I wouldn't want to take the chance. So again, I would check out that article on Hashimoto's encephalopathy on the website. But really, the main resource is going to be the Hashimoto's Triggers book. And yeah, I don't know of anybody. There's a lot of practitioners that focus on Hashimoto's. I focus, honestly, these days more on hyperthyroidism and Graves' disease, even though I wrote a book on Hashimoto's. I'd say most of my patient base, like probably like 80% now, consists of those with hyperthyroidism, Graves. And the reason I made that shift is just because there are a lot of people out there that a lot of practitioners that focus on Hashimoto's, but not enough that focus on hyperthyroidism, and Graves. And I still see some patients with Hashimoto's. Many of them find me through my book, but again, a lot of people who find me through my book, they end up working with someone else, just because again, there's other. Many times my book is not the only one they read, but yeah, so I don't know anybody who focuses on that, just because again, it's not too common. But yeah, like I said, I think those are good starting points. And again, you could always read other people's book. Dr. Isabella Wentz has a number of books on Hashimoto's that's popular. And there's other books, other authors out there as well. Actually, there's Dr. Datis Karazian, who he wrote. So his last name Kharr, Karazian, Azian. First name D as in David, Datis, Datis. And so he wrote a book. It's been over 10 years since it's been released on Hashimoto's, but then wrote also a brain book, which is really fascinating. I think that was released in 2016. Okay, so Garnett, thank you. What supplements do you suggest? So Garnett asked about anything you can take besides levothyroxine. So again, there's nothing I could tell you to take in place of levothyroxine that's a supplement or herb. That's what I was explaining earlier. Like you could take desiccated thyroid, or there's a supplement, Biotics Research, like GTA Forte, or just GTA. Again, I'm not telling you to take these, but there's those are like, that's a glandular. And then I mentioned Thyrogold. There's a number of different companies with different glandulars, but they still have thyroid hormone in them. There's no supplement you could take to replace thyroid hormone. If you're just asking for like just supplements in general, again, I can't give you specific recommendations, but for my patients, some of the general supplements I recommend, like omega-3s, usually in the form of fish oils, probiotics. And, I like to do testing just to try to find the triggers, underlying imbalances, and then give the recommendations for supplements based on the test results. So like for reducing toxic load, a lot of times I'll recommend NAC, N-acetylcysteine, or like liposomal glutathione, and might recommend adrenal support. Actually, commonly recommend adrenal support, and yeah. So it really does depend on the person. Uh, and again, visit my website. I do talk about different supplements. Selenium is one I commonly recommend. But yeah, I'm not a big fan of just like giving general recommendations of supplements, because not everybody needs to take the same things, the same supplements. There's a few, like I said, omegas most people are deficient in. But okay, Garnett, thank you, Dr. E. You answered my question. And you are welcome. And then, so this person asks, how can I work on lowering my TPO antibodies prior to knowing what's the cause of it? Currently, it's 2,500 after it was 1,600 just around a month ago. I mean, you could incorporate the basics. So diet and lifestyle are the main ways. So just trying to eat a whole foods, anti-inflammatory diet. And I mentioned earlier, if you didn't catch earlier presentation, like if someone's not gluten-free, you might want to test for celiac disease before going gluten-free. And so because in the past I've been guilty of just like saying, well, you could eliminate gluten, dairies, but I just want to emphasize, and it's great to go gluten-free and dairy-free, but yeah, that I would say, especially if someone's autoimmune, which again, you have the elevated thyroid peroxidase antibodies, so your case is autoimmune. But so diet, stress management is huge, and doing things to reduce your toxic load. You could do that as well, like minimize your exposure to xenoestrogens, plastic bottles, thermal paper receipts, and just in your home, use natural cleaners, cosmetics. And so just without even taking supplements, you could do things to reduce your toxic load. And I do sauna therapy a couple of times per week. I actually did it this morning, and so that also helps to eliminate toxins from your body. But really does come down to finding or removing triggers. So again, your TPO antibodies might not lower until you really get to the more, like I was going to say, the more significant more significant triggers. And food, for some people, it could be significant, but for others, it's not the main trigger. So food for everyone's important. If someone's eating if someone's eating inflammatory foods, they're not going to heal. But I have people who join my program and they have been following AIP even before seeing me. Some have not been following, but AIP, again, autoimmune paleo, and sometimes doing that alone could do wonders. Sometimes it doesn't do anything, and that means that there are other pieces of the puzzle. Okay, so hyperthyroidism diagnosed on February 15th, doing autoimmune paleo and supplements with functional doctor and finding some improvements, or struggling to gain weight. Any suggestions? So the two main reasons people with hyperthyroidism, and some people have the opposite problem where they are gaining weight and they want to lose weight. But I was in your situation. I lost 42 pounds when I dealt with hyperthyroidism back in 2008, and the number one reason is due to the thyroid elevations in thyroid hormone, and then number two, problems with the gut. So if the thyroid hormone levels are still elevated, that's a big reason why you're probably struggling to put on weight. And people will ask me all the time, what can I eat to gain weight? Like what foods, I'm wasting away. What foods can I eat to gain weight? But if they're still hyper, it's going to be difficult to counteract that through diet. So whether it's through anti-thyroid medication or herbs such as bugleweed, or another method, you want to do things to lower the thyroid hormone levels. And then if someone has normal thyroid hormone levels, it very well might be related to the gut, having some type of malabsorption problem, for example. And so we need to make sure we balance the thyroid hormone levels and optimize the health of the gut. And if there's a gut infection like H. pylori or parasites or anything else, we need to address that. There's an article on my website and also my podcast, SaveMyThyroid.com. There's so I spoke about the 5R protocol, and really that's focusing on how to improve the gut health, because that's people ask all the time. Well, how do I heal a leaky gut? How do I optimize my gut health? And you follow the 5R protocol. And so the very first R is remove. So remove things such as gluten, or again, if someone has a gut infection, glyphosate, things that could affect the intestinal barrier and the gut microbiome. And then you could follow the other R's. I mean, you could do all of them at the same time if you want, but you need to address that first R if it's a gut problem. Again, if your thyroid hormone levels are elevated, that's what I would focus on initially. All right, so Stania Lane asked about the lowering of the antibodies and said, okay, I'm on selenium already, and I've had some viral issue and ENT infection. I'm still trying to save money to get an appointment with you. Yeah, I mean, again, in the meantime, I give a lot of information on my website and on my podcast, which I know you know my website, and I think you're familiar with my podcast. So definitely try to do as much as you can with that. And the selenium is helping. Viruses, again, remember, focus on immune system health and diet, stress management. Stress is huge when it comes to viruses, and just trying to not necessarily eliminate the stressors, because for many of us it's not possible to do that, but just again improving stress handling skills. And again, there are antiviral herbs. There are things like, for example, olive leaf that can help in some. So now for an ENT infection, well, you said viral issue and an ENT infection. So yeah, I won't get into detail with that. That's sometimes could be tricky, but yeah, again, just and also my books, of course. So just for free information, there's a lot on my website. Now the podcast is, I've had now over 30 episodes, not including Q&A episodes I do. So again, there's a good amount of content on there and more to come. And then like I said, my books, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, as well as Hashimoto's Triggers. Okay, Lisa, you are welcome. And then her question, what's your thoughts on Tepezza for Graves? So I actually had a conversation with Dr. Ronnie Bannock. I've had a few conversations. So she's a board certified ophthalmologist, practices in Manhattan, and she takes an integrative approach. She does both. She does recommend conventional methods, and also takes an integrative approach. But there's an interview on my podcast. I think it's episode. Actually, I'm not sure what episode. I'm trying to think now. I thought I was going to say 32, but it's earlier than that. 26. I think it's 26. And she's also on my YouTube channel, Natural Thyroid Doctor. But we talk about Tepezza. I asked her about Tepezza, and she likes it a lot. Now, she it's definitely a breakthrough when it comes to thyroid eye disease. Everything's that comes down to risk versus benefits. And if someone has severe thyroid eye disease, it might be something to consider. But there are potential side effects. First of all, it's infusions. For those who are not familiar with Tepezza, it involves 8 infusions, I believe 3 weeks apart, and it acts on the insulin growth-like receptors, and it seems to work well in some cases of when someone has exophthalmos, ptosis, the bulging eyes. I've had not a lot of patients, but I've had a few patients on it when it works. Again, I didn't necessarily recommend it. I didn't say you should get Tepezza. They pretty much got it on their own. There was one person who had double vision and went through the 8 treatments, and that really didn't help with that. And sometimes it can cause hearing loss, which it did in him. It's supposed to be temporary. And again, it's still new. So when I say it's supposed to be, it's only been out in the United States for a couple of years now. So and it's expensive. If someone has health insurance that covers it, great. Otherwise, it's a few $100,000, so most people won't be able to afford it. And, of course, it's not addressing the cause of the problem. I also have an article on Tepezza, which I wrote. I think I wrote after it came out, like shortly after it came out. So, definitely, I mean, you could read that, but definitely tune into the interviews I had with Dr. Ronnie Bannock. Again, savemythyroid.com, savemythyroid.com, click on podcast, and I'm pretty sure it's episode number 26. And so that, that was more recent, and I'm sure we'll learn more as it's out for a longer period of time. But yeah, if someone has severe thyroid eye disease and it's in the active stage, then it's something maybe to consider. I help people with thyroid eye disease, but honestly, if it's severe, there's no guarantees either way. Like if someone works with me and they have mild to moderate, there's a greater chance of reversing the thyroid eye disease condition, and we do that by addressing the autoimmune component, because thyroid eye disease is an immune system condition. But if it's more on the severe side, I'm not saying they can't be helped naturally. And Dr. Ronnie Bannock talks also about things that people could do as well from a natural standpoint. It's not just on the Tepezza as far as our conversation, but again, when it's more severe, that's when I would still say, and for some people, consider doing things naturally. But obviously, it depends. If someone is having really bad double vision, like symptoms that are affecting their life, their quality of life. But as I said, even the Tepezza in that example I gave, it didn't help with the double vision. Now, I didn't know this until I interviewed Dr. Ronnie, and I don't think she said this during our most recent interview, but we had another one last year. And I'm pretty sure she said people could go through more than one round. So they could go through the 8 treatments, which would be like one round, and then go through like another, rounds of 8 treatments with the Tepezza. I guess, that's an option if someone, let's say they go through the first 8 treatments and it helps, but there's still room for improvements, then they could, I guess, go through another 8 infusions. So, but yeah, so, I think there's a time and place for it, but it wouldn't be something for most people, it wouldn't be something I would jump into. Same thing with the surgery. Obviously, there's time and place still for different types of surgery, including decompressive surgery, but it's usually not the first thing someone would want to do. So this person was just diagnosed, hasn't seen an endocrinologist yet, not well on carbimazole, which carbimazole converts into methimazole, typically given in some areas out of the country, especially like Europe, United Kingdom. So what can I take to help me until I see the specialist? So again, without giving specific recommendations for you, just because everybody's different, and but I took personally bugleweed, and I recommend bugleweed to a lot of my patients who are unable to tolerate the medication. And so that is, so the bugleweed, there's L-carnitine. What I would do, again, the podcast, visit savemythyroid.com. Let me just put that up there again, even though it's easy enough to, yeah, so savemythyroid.com, visit podcast. And then episodes 2 and 3 talk about conventional and natural treatment methods. So you might want to focus more on the natural methods, or the symptom management specifically. Specifically, symptom management is what episodes number 2 and 3. One is on conventional treatment options, symptom management options, and the other one is more natural symptom management options, where we talk more about bugleweed and motherwort and lemon balm and L-carnitine. All right, and Tommy, thank you for your response. Okay, blood test pending. And again, that's one of the disadvantages. Again, if someone's in a Facebook group, like I have no idea who this person is. Like I'm assuming they brought something, they asked questions sooner, but I don't know who it is, because unless if someone gives StreamYard permission to use their name, which I think some people just don't, like they miss. It's not that they don't want to give StreamYard their name. Some people might not want to, but some people just might not know how to. And again, it's the original post that was posted yesterday about this Facebook Live. There was a little link on that, so I'm pretty sure you would have to go to that. So Lisa, so same, lost 40 pounds with hyperthyroidism and years on methimazole, now can't lose weight at all. Yeah, so that's that like some people, I lost a lot of weight, and then like you lost 40 pounds as well. But yeah, there's some people that gain weight and then they can't get it off. Methimazole obviously is one factor, but there's some people that aren't taking antithyroid medication and still have weight issues, even though they're dealing with hyperthyroidism. And I have an article on that. I actually have I have an article, again, an episode on my podcast. And then recently I interviewed Dr. Weston Childs, and we spoke about this topic too, which is on my it's on my YouTube channel. Pretty soon it'll be on my podcast. What I do when I interview someone, I put it on my YouTube channel, on my podcast, but I do it at different times. And so right now it's on my YouTube channel, Natural Thyroid Doctor, where I interview Dr. Weston Childs about weight gain and speaking about hyperthyroidism, and he talks about leptin resistance. So Esther asks, my TPO is under 8. Is that considered Hashimoto's? So Hashimoto's, for most labs, would consider that to be negative. Things have changed over the years for the antithyroid globulin antibodies. Labs, the range, most labs would have a higher range, but now a lot of them are using less than 1. So it might go in that direction with TPO antibodies, but typically that's negative, considered negative by most labs. And just the antibodies by itself being elevated it's not diagnostic of Hashimoto's or Graves'. Like if someone has elevated thyroid stimulating immunoglobulins, those are the antibodies for Graves', but they're not really diagnosed with Graves' unless if they also have hyperthyroidism, like depressed TSH and elevated thyroid hormone levels. And if they have depressed TSH, elevated TSI, normal thyroid hormone, then that's like subclinical Graves'. With Hashimoto's, typically it's diagnosed when someone has an elevated TSH, thyroid stimulating hormone, and an elevated thyroid peroxidase and or antithyroid globulin antibodies. All right, again, I'm going to go another 12 minutes. I know I'm not going to get probably to all questions here, and I apologize, but I think I will be on next week at 2 p.m. answering questions. I'm not 100% sure what's next week. Yeah, so I think so. So if I don't get to you, the best advice I could say is get on early. Get on as close to 2 o'clock p.m. Eastern time, because I do go in order with the questions. And I'm going to just take a quick sip of water here. So my mom was in a thyroid storm and recently was in ICU and in the hospital for a little over 3 weeks. Now she has heart failure and AFib. She's extremely skinny and 123 pounds, but her abdomen looks like she's 9 months pregnant. I removed gluten, but she still tries to sneak sweets, dairy, and all junk food. She's not taking any supplements. I need help on what to do to help her. Yeah, this is really a complex situation. I would definitely recommend just scheduling an appointment with the functional medicine practitioner. And, you might even with what's going on, even though it's due to the hyperthyroidism and the thyroid storm, there are some cardiologists that focus on functional medicine. And, and they're also going to offer assistance with the diet, because that's the big thing. You said, wait, I removed okay, yeah. So your mom is trying to sneak in sweets, dairy, all junk food. There's only so much you could do. So you need to help on what to do to help her. But the question is, does she want to help herself? I'm sure she wants to get better, but everybody wants to get better when they're not feeling well. Just not everybody is willing to make the sacrifices. And that is a sacrifice, to clean up their diet and eat, an anti-inflammatory diet. So that if you go to any functional medicine practitioner, first of all, she's going to need to go. That's the worst thing is for like a family, like it's a different situation if it's a child, but other than that, for like let's say in this situation, your mom, is having issues with her health and you want to help her, and then let's say you schedule an appointment with the functional medicine practitioner but she's not there. You're just trying to get information. So you don't know if she's going to follow any of that information, and you want her to hear what the functional medicine practitioner is talking about. So, yeah, I would say maybe visit the Institute for Functional Medicine. They have a website. I think it's ifm.org, or just go into the search engine and do a search for Institute for Functional Medicine. And yeah, I would, schedule an appointment. You and her probably should be there, definitely her, but it sounds like you should be there too because you're offering support and you're the one really encouraging her to clean up her diet. And and then yeah, I mean there are supplements for cardiovascular health like motherwort, and hawthorn is really good. But again, I wouldn't, I can't say that she should take those supplements, but I would say working with a functional medicine practitioner, obviously every practitioner is different. So one, with a good amount of experience, and again, maybe one that's a cardiologist that practices functional medicine, and yeah, so that's the approach I would take. But it really is something she has to make the decision. And if she's, I mean, it's great if she's gluten free, but again, if that's all, if someone's gluten free, but they're still eating a lot of other inflammatory foods, it's going to be hard to recover. Michelle asked the question: does hypothyroidism cause you to be very tired? Does it also cause you to clear your throat all the time? So the first one is definitely very common. Low thyroid hormone levels definitely can cause fatigue. There can be other factors, adrenal problems as well, which is very common in people in general, including those with hypothyroidism, and low nutrients. I mean, there's a lot of things that could cause fatigue, someone to be very tired, but yeah, the low thyroid hormone levels alone could do that. As far as it causing someone to clear their throat all the time, that I can't say that's a classic symptom or even a common symptom. Both hypothyroidism and hyperthyroidism can cause a goiter, like a swelling of the thyroid, which sometimes can cause that symptom. It's that people that clear their throat. But so it could be related, but it also could be connected to something else. All right, Esther also is Hashimoto's reversible. So the autoimmune component, I like to say, is reversible, but it depends on what you mean by reversible. There's, again, I mentioned a triad of autoimmunity earlier, which is that genetic component. So by reversible, I don't mean permanent cure necessarily. Like the same question could be asked for Graves' disease because both Graves and Hashimoto's are autoimmune. I've been in remission since 2009, which has been what? That's 13 years almost now. And I feel like I've been cured, but I know I could relapse. So I don't consider myself to be cured. So when I talk about reversing Hashimoto's, reversing Graves, I'm talking more about the autoimmune component and, having people feel better, have them, not experience the symptoms associated with that specific condition. But it doesn't mean that someone can't relapse. There's the risk of myself relapsing, even though, again, it's been quite a long time since I dealt with Graves. So like I said, it depends on what you mean by reversible. So Christy finally had an uptake test yesterday. I've been suffering for 2 years, possible Graves and thyroid eye disease. All right, thanks for the update. Definitely also make sure you get the antibodies tested. So I wouldn't rely just on the radioactive iodine uptake test for diagnosing Graves, and I would make sure they test the TSH receptor antibodies, specifically the thyroid stimulating immunoglobulins. Okay, Lisa, thanks for all the great information. Appreciate you. You are welcome. Thank you. Thanks for attending. And thanks for your questions. Appreciate you and everyone else who showed up to ask questions. All right. So, Christy, methimazole caused pancreatitis for me. It was awful. My thyroid eye isn't great, but isn't horrible. Just feels bad. Looking for natural options. Yeah. So so yeah, obviously the methimazole is something that, that I'm sure your medical doctor took you off. And I mean, some people who are unable to tolerate methimazole, they might be okay with PTU, which is another type of antithyroid medication, but that's not always the case. Again, I took bugleweed, was the herb I took when I dealt with hyperthyroidism when I had Graves' disease, and that helped greatly. In my case, with the thyroid hormone levels and the symptoms, doesn't work for everybody though, so that's something to keep in mind. I mentioned earlier on my podcast, episodes number 2 and 3, where I talk about both conventional and natural symptom management options, and then for the eyes, again, episode number 26. And I think might be episode 10. One of the first 10 episodes of my podcast are solo episodes. So I think it might be episode number 10 or one of the first 10, if not that one, where I just do a solo episode where it's just me talk about thyroid eye disease. But then episode 26, I'm pretty sure, is the episode where I interviewed Dr. Ronnie Bannock on thyroid eye disease. And again, she's a board certified ophthalmologist, and she also recommends natural options. It's not just all about medication or getting thyroid surgery if someone has Graves. And all right, so can motherwort assist in lowering heart rate if on prednisone? Not a fan of beta blocker atenolol. Also on 10 milligrams of prednisone for thyroiditis. Yeah. So I mean, if someone's obviously the atenolol should help with that, but if someone chooses not to take atenolol, because again, I can't tell anybody to stop taking their beta blocker. So if you're on prednisone, which is going to help with the inflammation, and that might help also with the heart rate. But if someone's on that and that's and they stop taking the atenolol on their own, motherwort could, as it depends. If someone's hyper, the problem with thyroiditis is they don't want to give antithyroid medication because a lot of times people with thyroiditis will shift towards the hypo side. And so motherwort, like when I dealt with Graves, I took bugleweed, which helped to lower the thyroid hormone levels, which helped to lower the heart rate, but I was still experiencing palpitations. And so I took the motherwort, and that helped. If I took motherwort and not bugleweed, maybe it would have helped to lower the heart rate, but it's not really having an impact on the thyroid hormone levels. So the honest answer is I'm not sure. It depends if your thyroid hormone levels are still high. If they are, then the motherwort might not help. Now, again, in some cases of thyroiditis, I'll give the person bugleweed, even though, again, they might shift to the hypo side. So we need to keep that in mind. But because the problem is with thyroiditis, that they might become hypo in a few weeks, or it might be a few months. And if it's a few weeks, then again, maybe not as big of a deal if you're not managing the hyperthyroidism during that time, even though, and again, it's not like you're not doing anything. You're taking the beta block, which is managing the heart rate, and the prednisone, again, the inflammation. But again, I'm not sure. It depends on the situation. Motherwort, if your thyroid hormone levels are still high, it might help a little bit. But if your resting heart rate is in triple digits, it probably won't alone lower to in the 60s or 70s, but maybe it'll get it, in the 80s or 90s, for example, and maybe not. So it potentially can. All right, so this is going to be my last question actually, this is not a question. So this is just thank you very much for the information. I'll check out the functional medicine website, and you are welcome. You are welcome. And yeah, thank you, everyone. Thanks for your questions, and hope you enjoyed the little presentation I gave at the beginning. If you didn't, anybody trickled in late, you could watch the recording. This automatically gets recorded to Facebook, so definitely check that out. And like I said, next week, I think I'll be on again at 2 p.m. to answer questions. Not 100% sure, but I'm pretty sure. And then 2 weeks from today, I will be doing an interview with another practitioner at 2 o'clock. So it's been a few weeks since I had a practitioner. Again, I've been doing interviews, but not everybody wants to be on Facebook Live. So it's nice. I enjoy interviewing people on Facebook Live, because again, it's nice. I enjoy answering questions, but it's nice also to get the opportunity to ask other practitioners questions. So again, that should be coming in a couple of weeks, and yeah. So anyway, everyone, hope you have a good rest of your day and a great weekend ahead. And hope to catch some of you at the next Facebook Live, which again probably will be next Friday at 2 p.m. Eastern time. All right. Again, take care, everyone. Speak with you soon.